When people talk about methamphetamine, they often talk about the rush, the energy, the euphoria. But clinically, there is another word that keeps surfacing, the one which the patient whispers, the one which the patient is hesitant to admit, yet repeatedly returns to. Yes, it is sex. So it's not just about the use of drugs and it's not just about sex. It's a powerful combination of the both which rewires the brain. Today, we are going to explore why methamphetamine and sex are linked so tightly and why ignoring this link can sabotage the treatment and relapse prevention. So the term Chemsex means the voluntary intake of a psychoactive substance, mostly methamphetamine or mephedrone, GHB or GBL, in order to enhance the sexual intercourse, mostly between men who have sex with other men. Meth is not just a stimulant, it is a reward amplifier. Most addictive substances increases dopamine in the reward circuit, but what meth does is something more extreme. It triggers a huge surge of dopamine which is far beyond the natural rewards or most of the drugs. So methamphetamine encodes importance. It tells the brain that this experience matters, repeat it. Now imagine that surge occurring during intense sexual activity. Brain doesn't just remember pleasure, it tags the emotions, the context and the sensations as biologically significant. So over time, sex and meth won't be two separate behaviors, it becomes neurologically fused. Now this becomes a trap from where escape is very difficult. What meth does to sexual behavior? Methamphetamine alters three major domains. It increases the sexual desire, it increases the perceived pleasure, and it lowers the inhibition. This combination leads to marathon sexual encounters, which is usually associated with sleep deprivation, low appetite, and high-risk sexual behaviors like unprotected sex, which can lead to HIV, viral hepatitis, and other STDs. But here lies the paradox. While the drive for the experience escalates, the genuine satisfaction declines over time. The brain keeps searching for the exaggerated pleasure rather than the authentic satisfaction. Later, even when the patient is sober, a thought, an image, or a memory can trigger cravings. At this point, the brain is not just saying or asking you, do you want meth? It is saying that just get it. With long-term repeated exposure, the brain begins to adapt defensively. So the dopamine receptors becomes less responsive and the natural rewards becomes almost mute. Sleep disturbances, no motivation, anxiety, reduced appetite, depression, and in some patients it will result in psychosis which might not be reversible. Why treatment often fails? One of the biggest blind spots in meth addiction care is the sexual dimension. So if we are going to ignore that, one of the core driver for the relapse is untouched. Recovery is not just abstaining from the substance. It is about retraining the brain to experience meaning, pleasure and intimacy in real, sustainable ways. When we understand the loop, we know where to intervene and how to help the patients break free from it.